Hello, Golden Vitality family. Did you know one of the most taboo topics in senior health might actually be good for you today? We're sharing what doctors and experts really say about masturbation and its health benefits for older adults. From boosting mood to improving sleep and reducing stress, you don't want to miss this honest, science-backed conversation. Stay tuned. Hello, and a warm welcome to you from all of us here at Golden Vitality. We're so glad you're spending some time with us today. Here, we cherish the journey of aging, viewing it not just as the passage of time, but as a rich season of life brimming with opportunities for continued growth, connection, and well-being. We believe in talking openly and honestly about all aspects of health, even topics that might feel a bit private or sensitive. Today, we're going to explore one such topic with care and respect, the question of whether seniors should masturbate, looking specifically at insights from the medical and health community. Our goal is simply to provide clear, helpful information based on current understanding, empowering you to make informed choices about your own health and happiness. As always, this information is for general knowledge. Please do chat with your own doctor or a trusted healthcare provider for advice tailored just for you. They are your best resource for personal health guidance. As we journey through our 60s, 70s, 80s, and beyond, life often unfolds in new and meaningful ways. Perhaps you find joy in the quiet satisfaction of tending your garden, watching seedlings sprout and bloom under your care. Maybe it's the infectious laughter of grandchildren filling your home, the rewarding feeling of volunteering at the local library or community center, or the simple pleasure of getting lost in a captivating book on a sunny afternoon. These experiences enrich our lives and contribute deeply to our sense of purpose and fulfillment. Alongside these pursuits, our physical selves remain an integral part of who we are. Our bodies naturally change with time. That's a given. Joints might feel a bit stiffer, energy levels may fluctuate, and our appearance evolves. However, the fundamental human need for touch, connection, comfort, and yes, pleasure often endures. Unfortunately, there's a persistent myth in our society that interest in intimacy and sexual expression simply evaporates after a certain birthday. This couldn't be further from the truth for many people. Human sexuality is a wonderfully complex and lifelong aspect of our being. It's far more than just intercourse. It encompasses a wide range of experiences, including affection, intimacy, sensuality, emotional connection, and self-pleasure, often referred to as masturbation. It's about feeling connected to our own bodies and experiencing sensations that bring comfort or joy. Thinking or talking about masturbation might stir up a variety of feelings, shaped by our upbringing, cultural backgrounds, personal experiences, religious beliefs. It's completely normal and okay to have mixed feelings or even discomfort with the topic. Please know that our intention here is not to tell anyone what they should or should not do. Instead, we want to provide a clear, medically informed perspective on this activity, exploring why understanding it can be relevant to your overall health and well-being as you age. It's about looking at a natural human behavior through the lens of health science, free from outdated myths or judgment. So, let's begin by understanding what we're discussing from a clinical standpoint. Medically speaking, masturbation is defined as the act of stimulating one's own genitals or other sensitive areas of the body, typically leading to sexual arousal and often orgasm, for the purpose of experiencing pleasure. It's a private act, something done alone. It is recognized by medical and psychological professionals as a common and generally normal part of human sexuality across the lifespan, practiced by people of all genders, ages, and relationship statuses. It is often considered a form of self-exploration and self-care. Now, to the core question from a medical perspective, is it okay for seniors to masturbate? The overwhelming consensus within the medical and psychological communities is yes. For most older adults, masturbation is considered a perfectly normal, healthy, and safe activity. There is no medical reason related to age itself that would make self-pleasure inherently harmful or inappropriate. In fact, as we will explore, research and clinical observations suggest it may offer several potential health and well-being benefits. For centuries, various unfounded myths have unfortunately circulated about masturbation, causing unnecessary worry and shame. You might have heard old tales claiming it causes blindness, grows hair on your palms, leads to mental illness, drains your energy, or causes infertility. Let us state this clearly. There is absolutely no scientific or medical evidence to support any of these claims. These are myths, plain and simple, often rooted in historical, cultural, or religious anxieties rather than biological fact. From a purely physiological standpoint, masturbation is a benign activity for the vast majority of people. The only potential physical risks might involve being overly aggressive, leading to skin irritation or minor injury, or using unsafe objects for stimulation, both of which are easily preventable with common sense and gentleness. So, if it's generally considered safe and normal, why talk about it in the context of health? Because understanding the body's natural responses during sexual arousal and orgasm can shed light on potential positive effects that might surprise you. Let's delve into some of these expert medical insights. Potential health benefits, a closer look. Medical professionals observe that the body undergoes several physiological changes during sexual arousal and orgasm, whether achieved through partnered sex or self-pleasure. These changes involve hormones, neurotransmitters, muscle activity, and blood flow, and they can have ripple effects on overall well-being. Stress reduction and relaxation. Life doesn't stop presenting challenges as we age. Managing health conditions, dealing with the loss of loved ones, navigating retirement, or worrying about family can all contribute to stress. We know chronic stress takes a toll, potentially impacting sleep, mood, immune function, and even heart health. Finding healthy ways to manage stress is paramount. Think about the deep calm you might feel after practicing deep breathing exercises, meditating, or engaging in a relaxing hobby like knitting or fishing. Sexual arousal and orgasm trigger a similar, powerful relaxation response within the body. When you orgasm, your brain releases a cascade of natural chemicals, including endorphins. These are often called the body's natural opioids because they have pain-relieving and mood-boosting effects, creating a sense of well-being or even euphoria. Another key player is oxytocin, sometimes called the love hormone or bonding hormone. Oxytocin promotes feelings of calm, trust, and connection, and it helps lower levels of cortisol, the body's main stress hormone. Therefore, the climax achieved through masturbation can serve as a potent, natural stress buster, helping to physically and mentally release accumulated tension. It's like a built-in mechanism for calming the nervous system. Natural pain relief. Those remarkable endorphins we just mentioned don't just make you feel good emotionally, they also act as the body's own painkillers, analgesics. Many seniors live with chronic pain conditions, such as arthritis causing joint stiffness and aches, persistent back pain, or frequent headaches. While masturbation certainly isn't a replacement for prescribed pain medications or therapies recommended by your doctor, the surge of endorphins during orgasm can temporarily blunt the perception of pain for some individuals. The mechanism is similar to how rubbing a sore muscle can feel good. The endorphins interfere with the pain signals traveling to the brain. Some people report experiencing temporary relief from various types of pain, including arthritic discomfort or migraines, following orgasm. It's a natural analgesic effect provided by your own body. While it might not erase the pain completely, even a short period of reduced discomfort can be a significant blessing. Improve sleep quality. "I just can't seem to get a good night's sleep anymore" is a common refrain among older adults. Changes in sleep patterns, underlying health issues, medication side effects, or anxiety can all interfere with rest. Yet, adequate sleep is crucial for physical repair, cognitive function like memory and focus, and emotional resilience. The combination of factors associated with orgasm, profound muscle relaxation, stress reduction, and the release of hormones like oxytocin and prolactin, which is also linked to feelings of satiety and sleepiness, can make it easier to fall asleep and potentially sleep more soundly. The deep sense of calm and physical release following orgasm can quiet a busy mind and relax tense muscles, creating ideal conditions for sleep. Some people find that self-pleasure before bed acts as a natural sleep aid, helping them unwind more effectively than other methods. If restlessness or anxiety keeps you awake, the tranquil after effects of orgasm might be a gentle pathway to dreamland. Cardiovascular considerations. Let's be precise here. Masturbation is not aerobic exercise in the way that taking a brisk walk, swimming laps, or cycling is. It doesn't replace the need for regular physical activity for heart health. However, sexual activity, including self-stimulation, does cause a temporary increase in heart rate, blood pressure, and respiration, similar to mild or moderate physical exertion, perhaps like climbing a couple of flights of stairs or doing some vigorous gardening. From a medical standpoint, for most people whose hearts are healthy enough for this level of activity, it's generally safe. Furthermore, the significant stress reduction benefit plays an indirect role in cardiovascular health. Chronic stress is a known contributor to high blood pressure and inflammation, both of which are risk factors for heart disease. By helping to manage stress through the release of calming hormones like oxytocin, regular sexual release, including through masturbation, might contribute positively to cardiovascular wellness over the long term. As part of a broader healthy lifestyle that includes diet, exercise, and managing other health conditions. Supporting pelvic floor health. Especially for women, the pelvic floor is a group of muscles forming a supportive hammock at the base of the pelvis, holding up organs like the bladder, uterus, and rectum. These muscles can weaken over time due to factors like aging, childbirth, and hormonal changes associated with menopause. Weakened pelvic floor muscles can lead to issues such as stress, urinary incontinence, leaking urine when coughing, sneezing, laughing, or lifting, or pelvic organ prolapse where organs shift downwards. During orgasm, the pelvic floor muscles undergo involuntary rhythmic contractions. From a physiological perspective, these contractions essentially exercise these muscles, helping to maintain or even improve their tone and strength. While specific exercises like Kegels, often recommended by doctors or physical therapists, are the most targeted way to strengthen the pelvic floor, the natural contractions during orgasm can serve as a complementary activity to help keep these vital muscles active and supportive. Prostate health considerations for men. The potential link between ejaculation frequency and prostate health is an area of ongoing medical research. The prostate gland produces seminal fluid. Some studies have suggested an association between more frequent ejaculation through any means, including masturbation and a lower risk of developing prostate cancer later in life. One prominent long-term study followed male health professionals and found that those reporting higher ejaculation frequency, defined in that study as 21 or more times per month during middle age, had a notably lower incidence of prostate cancer compared to those with less frequent ejaculation, 4 to 7 times per month. The theory proposed is that regular ejaculation might help flush out potentially harmful substances or carcinogens from the prostate, or prevent the formation of tiny calcification stones within the gland. It is very important to understand that this research shows a correlation, not necessarily direct causation. Other lifestyle factors could be involved, and more research is needed to confirm these findings and understand the mechanisms. Therefore, frequent ejaculation should absolutely not be seen as a replacement for regular prostate cancer screenings like PSA tests and digital rectal exams as recommended by your doctor. However, this potential benefit is a factor that medical experts consider when discussing ejaculation and prostate health. Boosting mood and emotional well-being. Beyond the physical relaxation, the neurochemical changes during orgasm can provide a significant mood lift. We've mentioned endorphins, but another key player is dopamine, a neurotransmitter heavily involved in the brain's pleasure and reward pathways. The release of dopamine contributes to the feelings of satisfaction, happiness, and motivation. In later life, individuals might face challenges such as social isolation, grief, or feelings of diminished vitality. Finding natural, healthy ways to elevate mood becomes increasingly important. The positive feelings generated by self-pleasure can act as a natural antidepressant, helping to combat feelings of low mood, anxiety, or listlessness by providing a direct experience of pleasure and release. It's like getting a dose of sunshine from the inside out. Enhancing body image and self-connection. Our bodies inevitably change as we age. We might notice more wrinkles, graying hair, shifts in weight distribution, or changes in skin texture. Sometimes, these changes can impact our self-esteem or lead to feeling disconnected from or critical of our physical selves. Engaging in self-pleasure can be a powerful way to reconnect with your body in a positive and accepting manner. It involves paying attention to your own physical sensations, learning or relearning what feels good to you now, and affirming that your body, regardless of age or appearance, remains a source of potential pleasure. This intimate act of self-exploration and self-care can foster a more positive body image and enhance self-esteem. It's a tangible reminder that you are still a sensual being, capable of experiencing physical joy. This can be especially meaningful if you've dealt with illness, surgery, or other health challenges that have altered your body. Reclaiming pleasure on your own terms can be a profound step toward feeling whole again. Providing a healthy outlet for sexual needs. Sexual feelings and desires often persist throughout life. Even if one doesn't have a regular sexual partner, seniors may find themselves single due to widowhood, divorce, or personal choice. Alternatively, they might be in a relationship where their partner is unable or unwilling to engage in sexual activity due to health limitations, lower libido, or other reasons. In such circumstances, masturbation offers a safe, accessible, and healthy way to address one's own sexual needs and release sexual tension. It allows for sexual expression and satisfaction without requiring a partner, providing a sense of sexual autonomy. Acknowledging and finding a healthy outlet for this natural human drive can contribute to overall emotional well-being and prevent feelings of frustration or deprivation. Addressing concerns specific to senior. While masturbation is generally safe, certain age-related changes or health conditions might require consideration or adaptation. Physical limitations. Conditions like arthritis, joint pain, decreased mobility, or recovery from surgery can sometimes make familiar positions or ways of touching difficult. This doesn't necessarily mean pleasure is off the table. Medical experts encourage creativity and adaptation. Trying different, more comfortable positions, lying on your side, using pillows for support, exploring gentle touch on various parts of the body. Pleasure isn't limited to genitals. Or considering the use of personal massagers or vibrators specifically designed for sexual stimulation might be helpful. These tools can be especially useful if hand dexterity is limited. The key is to listen to your body, be patient, and focus on what is comfortable and enjoyable. Impact of health conditions and medications. Certain chronic health conditions common in older adults, such as heart disease, diabetes, neurological disorders, or depression, can sometimes affect sexual function, desire, arousal, orgasm. Similarly, some medications, including certain antidepressants, Blood pressure medications like beta blockers or diuretics, antihistamines, and others can have side effects that impact libido or sexual response. It is crucial to discuss these issues openly with your doctor. Sometimes, adjusting medication dosage, switching to a different drug, or treating the underlying condition more effectively can help. Your doctor can provide guidance and reassurance, emphasizing that experiencing changes doesn't mean your sex life is over. Hormonal changes. Menopause leads to a significant drop in estrogen levels in women, which commonly causes vaginal dryness, thinning of vaginal tissues, atrophy, and reduced elasticity. This can make any form of vaginal touch or penetration, including self-stimulation involving the vagina, uncomfortable or even painful. The readily available solution recommended by doctors is using a lubricant. Water-based or silicone-based lubricants found over-the-counter at pharmacies can dramatically improve comfort and pleasure. In men, testosterone levels tend to decline gradually with age, which can sometimes contribute to decreased libido, changes in erectile function, or less intense orgasms. If these changes are bothersome, discussing them with a doctor is important. They can check hormone levels and discuss potential treatment options if appropriate. Psychological and emotional factors. Emotional well-being significantly impacts sexuality, grief after losing a partner, ongoing depression or anxiety, stress, past negative sexual experiences or trauma, body image concerns, or relationship difficulties can all dampen sexual desire or make intimacy even with oneself feel challenging. If psychological factors are interfering with your ability to experience pleasure or connect with your body, talking with a therapist, counselor, or psychologist can be incredibly helpful. They can provide tools and support for addressing these underlying issues. Practical advice for comfort and safety. If you choose to engage in self-pleasure, medical advice emphasizes a few simple practices. Basic hygiene is important. Ensure your hands are clean before and after touching intimate areas. If using any sex toys or devices, clean them properly according to manufacturer instructions to prevent infections. Lubrication. This is especially crucial for postmenopausal women due to potential vaginal dryness. But men can also find it enhances sensation and comfort. Using a good quality lubricant reduces friction, prevents irritation or tiny skin tears, microabrasions, and generally makes the experience more pleasurable and comfortable. Opt for water-based or silicone-based products. Avoid oil-based lubricants like petroleum jelly or baby oil, particularly if using condoms, though not relevant for masturbation or silicone toys. Listen to your body. Pay attention to your body's signals. Masturbation should feel good. If you experience pain, stop or change what you're doing. Be gentle, especially if you have sensitive skin or physical limitations. There's no need to rush. Focus on relaxation and sensation. Ensure privacy. Feeling safe, secure, and unlikely to be interrupted is key to relaxation and enjoyment. Find a time and place where you can be alone and comfortable. Your doctor as a partner in health. Perhaps the most important medical insight is the encouragement to communicate openly with your healthcare provider, your doctor, whether it's your primary care physician, gynecologist, urologist, or geriatrician, is there to support your overall health, and that includes sexual health. Don't hesitate to bring up concerns about sexual function, pain, libido changes, or questions about activities like masturbation. A good healthcare provider will approach the topic professionally, respectfully, and without judgment. They can assess whether any underlying medical conditions or medications might be affecting your sexual health. Provide personalized advice on managing physical limitations or health-related sexual changes. Recommend appropriate treatments, like lubricants or potentially hormone therapy if indicated. Address any unfounded fears or myths you might still harbor. Refer you to specialists like physical therapists for pelvic floor issues, or therapists for psychological concerns if needed. Remember, sexual well-being is an integral part of overall health and quality of life at any age. Your doctor understands this and should be a resource for you. Embracing fullness of life. So, should seniors masturbate from a medical standpoint? The answer is clear if you wish to. It is generally a safe, normal, and potentially beneficial activity for most older adults. There's no medical reason related to age itself to avoid it, and it may contribute positively to stress management, sleep, mood, and even certain aspects of physical health like pelvic floor or potentially prostate function. Ultimately, the decision is entirely personal. It's about your comfort, your values, and your choices regarding your own body and well-being. There is absolutely no obligation to engage in self-pleasure if you have no interest. However, if you are interested or curious, medical experts encourage shedding any lingering shame or fear based on outdated myths. Understanding the potential benefits can empower you to see it as one possible tool among many, alongside things like enjoyable exercise, good nutrition, social engagement, and hobbies for nurturing your health and happiness. It aligns with the deeply held values of personal freedom, dignity, and the pursuit of fulfillment throughout life, acknowledging and attending to your own needs for comfort, release, and pleasure is a valid aspect of self-care and self-respect. We hope this discussion, grounded in medical insights, has been helpful and empowering. At Golden Vitality, we believe in supporting your journey towards a vibrant and fulfilling later life in every way possible. Remember, your health is unique, and the choices you make are yours. If you have more questions or wish to discuss your personal situation, we strongly encourage you to reach out to your doctor or another trusted healthcare professional. They are your best partners in navigating your individual path to wellness. Thank you for joining us today. Be well, take good care of yourself, and continue to embrace the richness of your life journey.